2023 was a year of challenges and opportunities for the KidsPeace organization coming out of the COVID-19 pandemic era. The pandemic prompted greater awareness of mental health issues, especially among children, which in turn led to a dramatic increase in demand for services from providers like KidsPeace. But at the same time, mental health providers faced extraordinary workforce shortages. The result, a growing unmet need for mental health care, and the recognition that more had to be done to meet that challenge. In response, KidsPeace set out to meet the staffing challenge with new approaches to workforce recruitment and retention. They included increases in pay and improved benefit offerings, made possible by higher reimbursement rates from payer organizations who recognize the value of our programming. The improvement in benefits were centered on the needs of younger workers. Younger workers were also the focus of improvement in training and engagement of associates, aimed at improving employee satisfaction and retention. Recruitment strategies were also updated and used, from non-traditional advertising to more effective strategies for contact with candidates, to upgraded referral bonuses for current employees to recommend new workers.
We made a lot of very meaningful investments in wages, and I think that has led to us hiring and being able to hire and retain more individuals, which we certainly did last year, and we hope that will continue.
2023 also brought new programming opportunities throughout the KidsPeace network. Expansion into case management, assessments, home studies, and supervised visitation services. Opportunities for life coaching and mentoring to older foster children and those with autism. Outreach into schools and to parents to help them manage children's mental and behavioral health issues more effectively.
A lot of our, what I'll call organic growth, is occurring because people come to us and say, hey, look, you're doing this really well, but we have a need over here. Help us solve that need.
A new service that took a major step forward in 2023 was the Hope Center for Youth and Family Crisis in Fuquay-Varina, North Carolina. A partnership of KidsPeace and Alliance Health, the Hope Center is designed to provide 3 specialized services: a mobile crisis intervention capability, a behavioral health urgent care service, and facility-based inpatient care scheduled to open in 2024. Similar to walk-in urgent care facilities for physical health, the Hope Center provides a vital link for families to address the immediate needs of a child or adult in crisis and to assess next steps for their care. The Behavioral Health Urgent Care Service opened in June and by year's end had helped more than 350 children and adults in crisis.
This is the first mental health crisis center with an urgent care attached to it for children here in North Carolina. It's the first one that KidsPeace has ventured to do. It's not going to be the last.
The staffing moves and program advancements put us on the path to address the challenge of having enough capacity to provide services for the growing number of families and children in need. In 2023, KidsPeace saw increases in program admissions, clients served, and episodes of care delivered from the previous year, as well as outreach efforts based on our mental and behavioral health expertise. Our programs helped clients achieve significant improvements in the severity of their symptoms and were rated highly in client surveys in the 6 aspects of the KidsPeace model of care. More than 4 out of every $5 spent by KidsPeace goes directly to pay for program expenses and associate salary and benefits to provide the care and treatment to the individuals who need it. As a nonprofit, KidsPeace is able to provide its best-in-class care in large part to the generosity and commitment of our more than 750 donors and supporting organizations. Thank you. KidsPeace and its associates remain committed to its mission of providing hope, help, and healing to children, adults, and those who love them, with the knowledge that overcoming today's challenges will help the young people we serve have the opportunity to thrive as their journey in life continues.
There was a time before KidsPeace I didn't want to make it to my 18th birthday. I was resolute and focused on not having to hit that milestone. despite my best efforts and focused on doing that, by the time I left KidsPeace, I understood that I would live past my 18th birthday, and I would live, you know, a good and full life if I wanted to. I would honestly say that you're safe at KidsPeace. You can heal at KidsPeace, and it can change your life if you let it.